Okay, so first thing, go ahead and introduce yourself, your educational background, and your job title right now.
Okay, my name is Jody Hickman. I graduated from Eastern Washington University. I am the only athletic trainer at Centralia High School, so a secondary job setting. I also teach sports medicine full-time, but I am required to work after-school sports and all home games.
And then how long have you been practicing?
I have been practicing for 2 years now.
Okay, so we're going to talk a little bit about evidence-based practice. To you, what is evidence-based practice?
To me, evidence-based practice is reading what current research supports that works best for patients, whether that's test validity or recovery protocols or what have you. It's what's going to work best for the athlete and what has the most validity.
Okay. How do you utilize evidence-based practice in your athletic training room?
I learned a lot of evidence-based practice things in college. So I've used a lot of the research that I did in college in my practice in the sports medicine, in the athletic training room. For anything that comes out that's new, I read a lot of position statements that come out from NATA. I do have a subscription to the Journal of Medicine that I read up on those things, but a lot of it that I get is from PTs. A lot of it's on rehabilitation protocols. So if I want to know what's the best way that we're going about doing winging scapula type of pathology, that's when I'd ask for specific protocols on those things. I will have to say that the fault that lies there is that you're relying on them knowing the validity of that sort of protocol.
So my next question was, how much experience do you have with evidence-based practice? So maybe talk a little bit more about what your college structure on that was like.
Okay. So when I was at Eastern, we had to attend a evidence-based practice class. I think it was called Current Topics in Athletic Training. We attended that class once a week, and we discussed what evidence-based practice is, how to find evidence, like the best evidence that's out there, how to compare different research to each other, being able to determine what validity is and how to read the different symbols and case studies and trial, cohort stuff, how to read those types of journals and studies and research. And so that's my background with it. I don't know if I'm answering the whole question. What's my experience with it? So that's where I learned how to conduct it, and that's really the length of the extent of my knowledge.
So do you teach evidence-based practice to your high school students?
I teach them, I informally teach them evidence-based practice. It is not this is what evidence-based practice is, and this is why it's important. That is not because I've been avoiding it. In fact, I plan on putting that into my curriculum next year. That was more of a fault of my own understanding how to teach people and what's important that high school students need to learn. So I do plan on having it in there. This far, it has not been.
Okay. Why do you think evidence-based practice is so important for athletic trainers?
I think that it gives us, the best phrase I can come up with is ground to stand on. I think as this profession is growing and people are understanding what we are, if we have and follow evidence-based practice, then we have the research and know-how to stand on firm ground. And it's not anything that's, we do it because it's what someone did before us and we did this before. It's actual, okay, we compared this to this and this is what worked and this is why we do it this way. I think it's more respectable of a profession when you have that sort of background and research and understanding.
Okay. And then my last question for you is, do you think in your experience other athletic trainers you've encountered have an understanding of evidence-based practice?
I want to offer some background to my situation. I don't get to network with a lot of other athletic trainers besides at the district conferences that we have, or district conferences that we have. In my personal opinion, I feel like if you are a younger athletic trainer, you do have a lot of experience and you understand what evidence-based practice is and why, hopefully, why it is important, because that was a part of the KD accredited programs, is we had to learn about evidence-based practice and what do you call those? BOC, I can't think of, competencies.
Yes.
We had competencies that matched up with them. So if you're younger, then if you just recently went through that athletic training program, I feel like you would. If you didn't, I do not know if you understand the importance, exactly what it is. Either way, I don't know whether you do or not.
Okay. Well, thank you. I think that's all I have for you.
Thank you.